What is osteoarthritis? Osteoarthritis is the most common joint disorder, caused by the gradual wearing down and degeneration of the cartilage that cushions the joints. It most commonly affects weight-bearing joints such as the knees, hips, hands, and spine. As the disease progresses, the cartilage may wear away completely, leading to bones rubbing against each other, causing pain, stiffness, and limited mobility. Although osteoarthritis is more common in older adults, risk factors such as obesity, joint injuries, genetic predisposition, and overuse of joints can contribute to its development at any age. While it is a chronic and progressive condition, symptoms can be significantly managed and quality of life improved through early diagnosis and appropriate treatment. In this video, I'll give you a closer look at osteoarthritis and explain both medical and natural treatment options in a clear and simple way. Osteoarthritis. Treatments. Osteoarthritis is not a condition that can be completely cured, but with the right treatment plan, symptoms can be significantly reduced and a patient's quality of life greatly improved. Treatment is usually tailored to the individual and consists of several core strategies. Let's go over these treatment options in order of effectiveness. 10. Other supportive methods. Canes, orthotic insoles, hot-cold therapy. In the treatment of osteoarthritis, alongside core approaches like medication and exercise, supportive methods also play a crucial role in easing daily life and relieving pain. These methods aim to reduce joint load, improve mobility, and help manage discomfort. Canes and walkers. For knee and hip osteoarthritis, canes and walkers help reduce stress on the joints, improve balance, and make walking easier. It's important to use them at the correct height and with proper technique, as improper use may lead to muscle strain or joint problems. Orthotic insoles and braces. Orthopedic insoles and knee braces help distribute pressure more evenly across the joint, increase stability, and slow the progression of joint deformities. They are particularly helpful in relieving pain in patients with damage on the inner side of the knee. Hot and cold. Therapy. Heat therapy helps relax muscles, reduce stiffness, and improve blood circulation. Cold therapy, on the other hand, is often preferred for reducing swelling and acute pain. These methods generally provide temporary relief, but are more effective when combined with other treatment options. Scientific research and evidence use of canes. A 2018 study found that cane use improved balance and reduced fall risk in individuals with knee and hip osteoarthritis. Insoles and braces. A 2015 meta-analysis revealed that proper insoles and knee supports significantly reduced osteoarthritis-related pain and improved joint function. Heat therapy. A 2020 randomized controlled trial observed that heat applications reduced morning stiffness and pain. Cold therapy. A 2017 review concluded that cold compresses provided short-term pain relief and anti-inflammatory effects in acute joint pain. These supportive methods serve as valuable complements to osteoarthritis treatment by improving patients' quality of life and helping preserve joint function. As always, these techniques should be used under professional supervision. 9. PRP and stem cell treatments. PRP, platelet-rich plasma, and stem cell therapies are innovative approaches that are increasingly being researched for the treatment of osteoarthritis. These methods aim to accelerate the healing of damaged joint tissue and reduce inflammation within the joint. PRP therapy. PRP involves injecting platelet-rich plasma derived from the patient's own blood directly into the affected joint. Platelets contain growth factors and healing proteins that can support cellular repair processes within the joint. PRP is most commonly used in early to moderate stages of osteoarthritis, with the goal of reducing pain and improving mobility. Stem cell therapy. In stem cell therapy, mesenchymal stem cells, typically harvested from bone marrow or fat tissue, are injected into the joint. These cells have shown potential to regenerate damaged joint tissue and decrease inflammation. However, stem cell therapy is still considered experimental and is not yet part of standard treatment protocols for osteoarthritis. Treatment process. Both treatments are typically administered over multiple sessions and are tailored to the individual based on clinical evaluation. The procedures are usually performed under local anesthesia, and patients may need a few days of rest afterward. Scientific research and evidence. A 2019 systematic review reported that PRP injections improved pain and joint function in knee osteoarthritis, although the effectiveness varied between patients. A 2021 meta-analysis on stem cell therapy noted improvements in joint function and pain relief in some patients, but also emphasized the lack of long-term data on efficacy and safety. For both therapies, there is currently no standardized dosage, treatment frequency, or protocol, so treatment decisions are typically based on clinical judgment and patient-specific factors. PRP and stem cell therapies offer promising potential in the management of osteoarthritis, but they remain investigational. Their use should always be guided by experienced professionals and conducted in specialized clinical settings following multidisciplinary evaluation. 8. Glucosamine, chondroitin, and collagen supplements. In osteoarthritis treatment, commonly used supplements aimed at supporting joint health include glucosamine, chondroitin, and collagen. These substances are believed to contribute to the structure of joint cartilage and help alleviate pain. Glucosamine is one of the fundamental building blocks of cartilage. When taken as a supplement, it may support the repair of joint cartilage and help reduce inflammation. It is typically taken in daily doses and recommended for long-term use to observe benefits. Chondroitin. Chondroitin sulfate is another essential component found in cartilage. It helps retain water in the cartilage, which contributes to its elasticity and shock-absorbing ability. It is often taken in combination with glucosamine for enhanced effect. Collagen is the main structural protein in joints and connective tissues. Type 2. Collagen, in particular, is found in articular cartilage. When used in supplement form, especially as collagen peptides, it may support cartilage repair. In recent years, several studies have suggested that collagen supplementation could help reduce osteoarthritis symptoms. Scientific research and evidence. A 2018 meta-analysis showed that glucosamine and chondroitin supplements had a mild to moderate effect in reducing pain in people with moderate osteoarthritis. However, effectiveness varied from person to person. A randomized controlled trial in 2020 reported that collagen supplementation led to significant improvements in both pain and joint function in patients with knee osteoarthritis. The effects of these supplements typically become noticeable after several weeks to months of consistent use. Quick or dramatic improvements should not be expected. Some patients may experience side effects. For example, glucosamine may require careful blood sugar monitoring in people with diabetes. Glucosamine, chondroitin, and collagen supplements may help alleviate osteoarthritis symptoms, but they are not considered standalone treatments. They should be used as part of a comprehensive treatment plan. 7. Topical NSAIDs, creams and gels. Topical NSAIDs, non-steroidal anti-inflammatory drugs, are the skin-applied forms of these medications. In osteoarthritis treatment, they are particularly preferred for reducing pain and controlling inflammation in superficial joints, such as the knees and hands. Compared to oral NSAIDs, topical forms are associated with fewer systemic side effects, making them a valuable alternative for patients with gastrointestinal issues or other systemic risks. Usage. Topical NSAIDs are typically applied 2 to 3 times daily as a thin layer over the affected joint. Hands should be washed after application, and the product should not be applied to broken or irritated skin. Regular and long-term use may enhance the therapeutic effect. Mechanism of action. The anti-inflammatory and analgesic effects of NSAIDs are achieved through inhibition of cyclooxygenase CoX enzymes, which are responsible for prostaglandin production. In topical form, the drug penetrates the skin and exerts a localized effect on the joint with minimal systemic absorption. Scientific research and evidence. A 2016 Cochrane review concluded that topical NSAIDs reduce pain and improve function in knee osteoarthritis to a similar degree as oral NSAIDs, but with significantly fewer systemic side effects. Randomized controlled trials published in 2018 showed that creams containing ibuprofen and diclofenac significantly reduced pain and improved quality of life in osteoarthritis patients. Topical NSAIDs may cause local skin irritation in some users. Therefore, skin reactions should be monitored during treatment. With their lower risk of systemic side effects, topical NSAIDs are an effective and safe option for pain management in superficial joint osteoarthritis. 6. Acetaminophen, paracetamol. Acetaminophen is a commonly used analgesic for managing mild to moderate pain caused by osteoarthritis. Although it has weak anti-inflammatory effects, it is often preferred by patients who wish to avoid the gastrointestinal side effects associated with NSAIDs. Usage. Acetaminophen is usually taken orally, 500 milligrams to 1,000 milligrams per dose, 3 to 4 times daily. The total daily dosage should not exceed 3 grams. It can be effective with regular use, though it may not be sufficient alone for managing severe pain. It should be used cautiously in individuals with liver disease. Mechanism of action. Acetaminophen works primarily within the central nervous system to reduce the perception of pain. It is less effective at inhibiting prostaglandin production compared to NSAIDs, which limits its anti-inflammatory properties. Scientific research and evidence. A 2016 systematic review noted that acetaminophen is less effective than NSAIDs in reducing mild pain associated with knee osteoarthritis, but is still recommended as a first-line treatment due to its favorable safety profile. A 2019 meta-analysis warned that long-term use of acetaminophen may increase the risk of liver toxicity, highlighting the importance of avoiding overdose. Acetaminophen is considered a safe and well-tolerated analgesic, especially in elderly patients and those who cannot use NSAIDs. Although acetaminophen remains a widely used and safe option for osteoarthritis pain relief, it should be combined with other therapies for managing moderate to severe symptoms. 5. Weight management and lifestyle modifications. In the treatment of osteoarthritis, weight management and healthy lifestyle changes are foundational strategies to reduce joint stress and slow disease progression. Excess weight, especially in the knees and hips, increases mechanical stress on joints, accelerating cartilage wear and worsening pain. Weight management. Maintaining a healthy weight or losing weight if overweight plays a key role in relieving osteoarthritis symptoms. Weight loss reduces joint load, eases inflammation, and improves mobility. Clinical guidelines suggest that a 5 to 10% reduction in body weight can significantly improve symptoms in overweight patients. Lifestyle modifications. Regular physical activity strengthens the muscles around the joints, enhances flexibility, and reduces pain. Low-impact exercises such as swimming, walking, and cycling are especially recommended. Additionally, a balanced diet, adequate sleep, and effective stress management contribute to overall health and joint function. Scientific research and evidence. A 2013 study showed that weight loss reduced pain and improved functional capacity in patients with knee osteoarthritis. A 2017 randomized controlled trial found that combining weight loss with exercise was more effective at reducing symptoms than either approach alone. The long-term benefits of lifestyle changes are closely linked to patient adherence and motivation. Weight management and lifestyle modifications are essential and effective components of osteoarthritis care. Educating and supporting patients in these areas significantly improves treatment outcomes. 4. Physical therapy and exercise. Physical therapy and regular exercise are cornerstone non-pharmacological approaches in the treatment of osteoarthritis. They aim to reduce pain, improve joint function, and enhance quality of life by strengthening muscles, maintaining joint range of motion, and balancing joint loading. Physical therapy. Manual therapy, electrotherapy, ultrasound, laser treatments, and hot-cold applications performed by physical therapists help relieve pain and increase mobility. Programs are tailored to the patient's individual needs and functional capacity. Exercise. Low-impact aerobic activities such as walking and cycling, strength training, and stretching exercises strengthen the muscles surrounding the joints and improve support. Regular exercise reduces joint stiffness and enhances functional performance. Scientific research and evidence. A 2015 meta-analysis showed that regular exercise significantly reduced pain and improved physical function in individuals with osteoarthritis. A 2018 randomized controlled trial found that physical therapy programs provided significant benefits in pain control and joint mobility in patients with knee osteoarthritis. The effectiveness of exercise programs is closely linked to patient motivation and adherence, making individualized support and follow-up crucial. Physical therapy and exercise are among the most effective non-drug interventions for managing osteoarthritis and play a critical role in improving patients' quality of life. 3. Cortisone. Steroid. Injections. Cortisone injections are a commonly used and effective method for rapidly reducing joint pain and inflammation caused by osteoarthritis. Steroids are injected directly into the joint to suppress inflammation and relieve pain. They are typically used in advanced stages of osteoarthritis or in cases of severe pain. Usage cortisone injections are administered under medical supervision, usually at intervals of 3 to 4 months. Due to the potential for cartilage damage with repeated injections, their use should be limited. Mild pain or discomfort may occur for a few days after the procedure. Duration of effect. The effects of cortisone typically last from several weeks to a few months. After the injection, patients may experience improved mobility and pain relief, though long-term benefits are limited. Scientific research and evidence. A 2017 meta-analysis found that cortisone injections significantly reduced osteoarthritis pain in the short term, but had limited long-term effectiveness. A 2018 randomized controlled trial reported that while the injections temporarily improved function, they might also increase the risk of cartilage deterioration with frequent use. Given the potential risks to joint structure with long-term or repeated use, cortisone injections must be carefully planned. Cortisone injections are a fast-acting and effective pain management option for osteoarthritis, but they should be used cautiously and not relied upon as a long-term solution. 2. Non-steroidal anti-inflammatory drugs. NSAIDs. NSAIDs are among the most commonly used medications in the treatment of osteoarthritis. Thanks to their pain-relieving and anti-inflammatory properties, they reduce joint pain and inflammation, thereby improving the patient's quality of life. They can be administered orally, topically, as creams or gels, or via injections. Usage oral NSAIDs are typically taken 1 to 3 times daily, depending on the severity of pain and inflammation. Topical forms are applied 2 to 3 times a day directly to the affected joint. Long-term use requires medical supervision due to the risk of gastrointestinal issues, kidney damage, and cardiovascular side effects. Mechanism of action. NSAIDs work by inhibiting COX enzymes, which are responsible for prostaglandin synthesis, thereby reducing inflammation and pain. Topical NSAIDs exert local effects with fewer systemic side effects. Scientific research and evidence. A 2015 systematic review showed that NSAIDs significantly reduce pain and improve function in knee osteoarthritis. However, caution is advised for long-term and high-dose use due to risks such as stomach ulcers, kidney failure, and cardiovascular problems. Several studies support that topical NSAIDs are as effective as systemic NSAIDs for pain management in superficial joints, but with significantly fewer side effects. NSAIDs are an effective and widely used treatment option for managing osteoarthritis pain. However, their use should always be monitored by a healthcare professional due to potential side effects. 1. Surgical intervention, joint replacement, arthroplasty. In osteoarthritis treatment, surgical interventions are considered in advanced stages where conservative methods are insufficient. The most common surgical procedure is joint replacement, arthroplasty. This operation involves replacing damaged joint surfaces with artificial implants, aiming to relieve pain and restore function. Usage surgical intervention is typically performed on patients experiencing severe pain, restricted movement, and significant difficulties in daily activities. The knee and hip joints are the most frequently replaced areas. Post-operative physical therapy is crucial for recovery. Duration and outcomes. Joint replacement usually provides many patients with years of pain-free movement and improved quality of life. However, Surgical risks such as infection and implant loosening can occur. Implants generally last between 15 to 20 years. Scientific research and evidence. A 2019 systematic review demonstrated that arthroplasty significantly reduces pain and improves function in patients with advanced osteoarthritis. Long-term follow-up studies report a 15-year implant survival rate of 85 to 90%. Physical therapy programs after surgery have been shown in numerous studies to accelerate recovery and enhance functional gains. Surgical intervention is an effective treatment option that markedly improves quality of life in advanced osteoarthritis patients, but must be applied considering risks and individual patient conditions. Osteoarthritis may not be a disease you can fully control, but with proper treatment and lifestyle changes, you can minimize its effects. Remember, investing in yourself at every step means giving your joints the care they deserve. Overcoming pain, regaining freedom of movement, and improving your quality of life is in your hands. Empower yourself with healthy choices and create significant changes with small steps. Every new day is an opportunity for a more active and happier life. If you believe in yourself, osteoarthritis cannot stop you. Wishing you healthy and active days ahead. Age is merely the number of years the world has been enjoying you.